Good afternoon, everybody. Hundreds of millions of people are being misdiagnosed or mistreated because no one's really talking about what is underneath that's attacking their body. So today we're going to be revealing the top 5 autoimmune diagnoses that are really common that nobody's talking about, including one sleeper diagnosis that I'm sure many of you have heard of. So what I'd like to do is, without further ado, we're going to be jumping right in. Here we go, everybody. Hey, everybody. I'm Maggie, MD, and I am a functional and holistic medicine MD physician who is actively licensed and practicing physician for the past 27 years. And my passion is about uncovering the underlying root causes of any chronic disease or mystery illness. So it's no wonder today that why we're going to be talking about autoimmunity. But that being said, I want to introduce and I want to bring up my co-host here, Ms. Kathy Ryan.
Hello. How are you today?
Wait a minute. She's wearing glasses today, so I'm going to pull out my glasses as well. So,
lovely.
I don't know if I can match that librarian look over there. What do you guys think?
Listen, it's only a librarian look because I have my hair back because the humidity is stupid here right now. And Dr. Maggie took one look at my hair and she said, oh, no, you got to put it back. And so this is why we have the librarian look going tonight.
I love it. Okay, everybody. Kathy Ryan's an instructor with Transform, and we're here tonight to really break the lid open on the top 5 diagnoses with autoimmunity. Now, what I would love for you to do right now is, if you're watching, is give me a thumbs up and tell me where you're watching from. And actually, you know what? Even better yet, we asked the question, what autoimmune diagnosis you have or you think you have. Type in chat immediately, wherever you're watching. What autoimmune diagnosis do you have? Might be more than one, most likely more than one. Or what diagnosis do you think you have? Or what diagnoses have you been dancing around with? Maybe not. Type it in chat, because this is a real big problem for a lot of people as an underlying root cause of their health issues. But there's some fundamental problems with just this whole concept of what are autoimmune diseases. Mm-hmm. So Eileen's watching. I love it. Jonathan's watching from Washington. Thank you. So Sudipta, Hashimoto's. Yes. Christy, dermatomyositis, right? And Heather, thank you for putting in POTS and PCOS, smarty pants. That is a stealth diagnosis, by the way. POTS, postural orthostatic tachycardia syndrome. How many of you guys know it's autoimmune related? Type in chat if you know it is. Smarty pants. I love that. Thank you, Heather. Amy Curtis, type 1 diabetes, Hashimoto's, and POTS. Notice Amy's pointing out a syndrome with 3 things. Which, we're starting to see patterns here. Okay. So yeah, lots of people have autoimmune disorders, and there are all these names that you're starting to see that are popping up in chat here. But a lot of people don't realize how much autoimmunity as a problem itself can target many areas in the whole body. And so this is one of the issues I want to bring up, is that a lot of time to talk about autoimmunity in a general term, and I brought up a name of a syndrome that I call MIST, multisystemic immune system targeting, which means that no matter what autoimmune disease you have an immune system that likes to target multiple systems. Okay. So I would love to call everything in the autoimmune category MIST, because that's the syndrome that we all have. That being said, when I was talking about this the last week and the week before, people were saying, can you help me? I have Crohn's. Can you help me? I have dermatomyositis. Or some people are like, I have a very rare autoimmune disease. I have scleroderma or something. Can you help me with that? So diagnoses is where a lot of the conversation and questions was centered around. So today we're bringing up these top 5 diagnoses. And Kathy, you've seen what they are. And, in chat already, we already saw the top 1 that typically comes up all the time. And so Donna says, Wayne Towers, Hashimoto's. Yeah. So yeah, if there's somebody that, that can benefit from this conversation, type it in chat. as well. So I'm loving all the input here with the diagnosis you have, but let's talk about number one. Okay. What number one? Okay. What number one autoimmune diagnosis that we often see is Hashimoto's or Graves. And a lot of people don't even know what that is. And it basically is an autoimmune attack against your thyroid. And whether it's Hashimoto's or Graves, just describes different areas that are being targeted or different activity on the thyroid that's being targeted. Kathy?
I don't even think people know that. I have run into so many people who say, you know, I have a thyroid condition, or however they put it, and they have no idea that Hashimoto's and Graves are basically, it's like not only are we giving all these different autoimmune conditions or autoimmune targets different names, actually giving an autoimmune target, so the autoimmune target on the thyroid, different names depending on how it presents.
Because it affects different activity of the thyroid.
Yeah.
But let's just look at the thyroid as a concept. In the thyroid alone, how many of you guys know how many different targets of autoimmune attack could there be in the thyroid? Just the thyroid alone, the size of a walnut at your neck. I'm not talking about the rest of your body, just your thyroid. How many different targets are there for your immune system to identify and attack? Do you guys know? Type it in chat if you do. And it ain't in the hundreds. Okay, so hint. Oh my gosh, Amy Curtis, thank you. Kim Miller, 6,000. So in just this gland, in the thyroid alone, 6,000 different areas, enzymes, cell parts could be under attack. And depending on where the attack is, it can cause your thyroid to increase in activity and over time decrease in activity. So we give it different names, whether it's Hashimoto's or Graves. But the truth of the matter is, let me just say something. How many of you have low thyroid out there? Who has low thyroid? Type low thyroid in chat. Okay. And I'm going to ask you guys, okay? How many of you guys with low thyroid know it's a result of your thyroid under immune attack? Okay. How many of you know that? And I'm going to ask everybody who's been paying attention, what percentage of people with low thyroid actually have an autoimmune related underlying cause of the damage to their thyroid? What do you guys think? Based on data, do you guys know what percentage of people with low thyroid actually have autoimmune disease of their thyroid? Neither they nor their physician know about. And I'm going to tell you, it's much greater than 50%. Okay. I'm going to tell you, is it 60? Is it 70? Is it 80? Right? Depending on the study you read, these are the latest studies, 60 to 80% of all low thyroid are actually related with an autoimmune attack against the thyroid. Okay. But here's the problem. Do you guys even know what percentage of thyroid disorders out of those 6,000 targets, what percentage of people can we actually do a blood test and say, you have one of those areas, one of those out of 6,000 under attack, you have autoimmune disease of the thyroid. How many targets can we even test for in the blood tests? In the best lab, maybe 10, 15, 11 actually. So if we can only test 11 out of those 6,000 targets, how frequently are we misdiagnosing and underdiagnosing people with thyroid disorders as having an autoimmune disease? If that's you, type it in chat, right? How many of you have low thyroid? And as we're talking,
not only that, we have 11 tests in the best labs, but how many people do we know that have had trouble even getting the two more commonly available labs from their doctors?
Catherine from Australia. What about you in Canada? I mean, you should share your own experience in Canada, Kathy.
Yeah, well, that's true. I didn't know that I had an autoimmune thyroid. I knew I had an autoimmune thyroid condition based on other factors, but I had never had my
You work with me. You work with
working with you. Yeah, I knew that I had an issue with my thyroid.
Right.
But I was never able to get those two tests done. And it wasn't until I went to the States just last winter that I finally got those labs done. And sure enough, I do have antibodies that are measurable. One of those two tests could have told me years and years ago that I had an autoimmune thyroid condition.
Well, but the truth is doctors aren't interested in testing for autoimmune antibodies on your thyroid. Even though we have 2 to 3 tests that are available in regular labs, they don't bother running it. And I'll tell you what the common endocrinologist or primary care provider says. Well, it doesn't make a difference in my treatment. And for them, do you guys know why it doesn't make a difference in their treatment? Is their only job is to see what they should adjust the medication dose of the thyroid is. No matter what the cause is, their only job is to say, we adjust this medication dose up or down. Mm-hmm. So their job doesn't actually involve, can we stop or calm the autoimmune attack against the thyroid? So if they have no tools, no education, no understanding of this, why the heck would they even bother testing it's autoimmune or not if their only job is to adjust medication? Mm-hmm. Right? Mm-hmm. Yeah. So I just want to share that with you. And in my own experience, I was never tested for autoimmune of the thyroid, even though I had 2 bouts of severe postpartum depression, fibromyalgia, hair loss, weight gain, depression. I was never tested for any of those antibodies on my thyroid. And it was only maybe once or twice in that 6 years that I was even tested with a TSH. And that's by my physicians, and I am a physician, right? So that's the level of ignorance out there just around this really common problem, which is low thyroid or high thyroid, any thyroid problems that is out there. 80 to 90%, 80% of you out there have a known autoimmune where your immune system is attacking the thyroid. But even if you were lucky enough to get the blood test, you wouldn't receive the diagnosis that this is autoimmune. And that is important. Why is it important? Right?
Why is it important? That's the big question, right? Because, I mean, in conventional medicine, it's not important.
Yeah.
It's not important.
Well, it's important for me because we're going to talk about other autoimmune diseases. And Dina is talking about, what do you know about Sjogren's? A lot. What do you know about Sjogren's? And here's the thing is that I care a lot whether something is autoimmune, because if somebody already has their immune system is attacking their thyroid, okay, mistaking one part of the body as a germ, what do you think is the likelihood that immune system is going to make a mistake and attack other parts of their body? So how often do we see someone with low thyroid that also has rheumatoid arthritis, low thyroid or high thyroid that also has POTS? This is all just other targets of autoimmune attack. So I care because if someone comes to me with thyroid problem, immediately in my head, and they come and they start having joint pain, do I dismiss it or do I start suspecting that there's another autoimmune target that's there? I suspect that. And that's why these connections really matter, right? So I just wanted to move from Hashimoto's to Dina's talking about Sjogren's, and we're going to talk about this group of the diseases, like example, rheumatoid arthritis. Let's talk about diagnosis number 2, rheumatoid arthritis, right? Now, there's about, just in the U.S. alone, there's about 1.3 million people with rheumatoid arthritis. That's those that have a diagnosis, right? And it is 3 times more common in women than it is men. This is going to come up as another question for some of you is, why are women affected more than men? Because we are, okay? But why is that? And we'll dig into that a little bit more. But think about the targets. In Sjogren's, we'll talk about the targets in a second, Dina. In rheumatoid arthritis, the target is actually against what we call synovial tissue. So in between, at the top of your bones, there's an area of the bone called synovium, okay? It's like a covering on top of the bone that's soft. That is the exact area in rheumatoid arthritis where certain proteins in that layer is under attack. And so as that layer gets under attack, that layer is destroyed. And then pretty soon, even the bone underneath it becomes destroyed. And this is where in rheumatoid arthritis over time, if you don't catch it early, that attack is so aggressive that you'll start to see the joints completely eaten up. And your fingers even start to get morphed. And it is not just fingers. It could be many different joints, shoulders, elbows, knees, right? Any joints, any area that has a lot of synovial proteins in it are going to be under attack. And that is one of the most common autoimmune diseases is rheumatoid arthritis, which is just one of the diagnoses because it just happens to be one of the ones where we've identified a blood test for a couple of the proteins on the synovium. So if we do the blood test, we'll say, oh, this person has rheumatoid arthritis. But how many people here have joint pain and they've tested negative for rheumatoid arthritis, right? And they're still experiencing these joint pains. Even on x-ray, they may even find that there's some really early changes in their joints and they're experiencing a lot of pain. Now, believe it or not, I said this like 7 years ago. Rheumatoid arthritis isn't the only autoimmune disease against, let's say, joints, right? That just happens to be one we could identify. Now there's such a thing as seronegative rheumatoid arthritis, which means that this person has all the hallmarks, all the physical findings, even the x-rays for rheumatoid arthritis, but that damn blood test is still negative. Mm-hmm. And back in the day, I'm talking like 3 years ago even, a rheumatologist would say, you don't have rheumatoid arthritis, there's nothing I can do for you.
Mm-hmm. Yeah. And not only is there nothing I can do for you, there's this whole gaslighting thing that happens with, oh, are you sure you're not just anxious? Or are you sure you're not just depressed? How old are you? You're over 40? Oh, that's what it is. You're just going to have to live with this.
This is what complicates the issue. You know, women get rheumatoid arthritis and Sjogren's, all autoimmune diagnoses. Women get way more than men. Okay. And the typical, I'm going to have you guys guess in chat. What do you think is the typical woman who shows up to talk to me or a doctor with any autoimmune disease? What do you think is the typical person? It's definitely a woman, right? Because we know it's way more women than men. But what do you think is the typical age of that woman who shows up in the doctor's office for any autoimmune disease evaluation? The average age of the person I see is a 47-year-old woman. And I'm going to ask you guys why. Why is the most likely person to be presenting in a doctor's office to be evaluated for autoimmune? Someone just wrote, Sonia wrote 47. You've heard me say that before. Evie says 40s. Sudeepta says 50. The average age person that I see is 47 years old, and it's a female. Now, let me ask you, why do you think that is the case? Right? Women are also more likely to be dismissed, yet they're most commonly show up with these autoimmune diagnoses that can't be diagnosed. And worse yet, they're coming in when they're 47 years old because something is happening to these women at 47 years old. And Carrie, you're right. Perimenopause. It is a time of dramatic hormone change. Okay. Anywhere from, believe it or not, 35 to 55. So that's why 47 is right there in the middle. But during that period of time, when a woman's hormones is changing really fast, it turns on the autoimmune attack. It makes the autoimmune attack like kerosene under fire 10 times worse. Mm-hmm. Okay. So there's a sexual bias in the terms of women are the most likely to show up with it. Women are the most likely to be dismissed with it. Women who are going through it also are presenting with a lot of hormonal changes that impacts their mental health, their brain fog, their ability to advocate for themselves. Mm-hmm. And there's a big hormone link to this problem. So does that make any sense? Is this like an aha for people? And if this is making sense, type in chat. Did this happen to you? I want to know from everybody out there watching, at what age did your autoimmune symptoms present? Type in chat, and at what age did they get a hell of a lot worse? Type it in chat to validate that. It means like, yep, right? Just so you know. And in my story, just so you guys know, at the age of 36, I was diagnosed on my own pushing with it with early menopause at the age of 36. And they told me, oh, you're just getting older. Yeah. No, I'm not just getting older and having menopause at 36. Thank you very much. What I found later, several years later, was I actually did the testing for autoimmune thyroid and diagnosed myself with Hashimoto's. And so it has occurred to me now that this is part of the MIS syndrome. Is people who have Hashimoto's, which is autoimmune attack against the thyroid, their immune system likes to attack hormone-making cells. So what's the likelihood of those very same men and women with Hashimoto's against the thyroid, the hormone cells, have problems with their sex hormones or their adrenal hormones or the brain hormones or blood sugar balancing hormones? Those cells look the same as your thyroid. So do you think it's really common for people with low thyroid problems to end up having tons of other hormone problems, blood sugar problems, and mental health symptoms? Because it's all part of the syndrome where multiple systems are under attack. Mm-hmm. Right.
Yeah. And I think the other negative bias, I think, towards women, especially when they're in their late 40s, going into menopause, sometimes that's used to dismiss their pain. Mm-hmm. And then the other thing that is used to dismiss their pain is the weight gain that often comes along with perimenopause. Mm-hmm. So instead of saying, ooh, you're suffering here with, joint pain.
Yeah.
There's this like how you put on weight. Maybe if you lost that 10 pounds, you'd feel better, right? Instead of actually, or are you depressed? Do you need an antidepressant?
Well, there's a tendency to dismiss and gaslight women to make this a problem about weight, appearance, or depression.
Yep.
Boom. Right? And Catherine actually mentioned something really critical. My daughter got worse after childbirth. She's 36 now. That's what happened to me. Yes. Because that was a big hormone change time when we deliver a baby, Catherine. So it isn't just perimenopause. It's when we deliver babies. It is certain times of the month when our hormones are going up and down. I remember that with Olivia that we're working with. Big hormone shifts causes big POTS symptom shifts, for example, right? These are clues. These are not cray-cray, okay? These are evidence and data that someone who knows what they're doing would be like, bam, 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 I know how to deal with this. But out there, it's like, oh, you're getting fatter. You need an antidepressant. You need therapy, right? There you go. Right. And then Dina says she had a total hysterectomy at the age of 40. And so she had very early hormone problems. And I bet you even the decade before, those hormone problems also mirrored hand in hand with the other symptoms related with her autoimmune issues. Right. Yeah. And so I just wanted to point out, like in talking about the group of joint types, autoimmune diseases like rheumatoid arthritis, it's really important to realize that there's thousands of different autoimmune diagnoses that could attack different areas in different joints or even in the bone, for example, or even in the ligaments or tendons that are not able to be diagnosed right now. Okay, there are no names for a lot of these diagnoses, but rheumatoid arthritis, it's a pretty big, very common but it's top autoimmune disease. In fact, it's the number one autoimmune disease in terms of numbers, but it's not actually. I have another one that's a super diagnosis. But what most people think of autoimmune diagnosis, you think rheumatoid arthritis. Now, I want to go through another diagnosis here. How many people out there have lupus or have the ANA possibly being positive, and is playing around and skirting around this diagnosis of lupus? How many people have lupus? Me, type in chat. How many people are skirting around with this? Now, this is a really interesting diagnosis, and there's no other autoimmune diagnosis that actually illustrates this MIS syndrome more. Because do you guys know what the target is that's being attacked in lupus is? Does anyone know what the actual target, some of the targets, common targets are in lupus? Type in chat, okay? Think about this. One of the tests to diagnose lupus besides ANA is anti-double-stranded DNA. Okay. What if you have an autoimmune disease and your immune system likes to attack DNA? Where in your body do you have DNA? That's genetic material. Okay. Where in your body do you have DNA? Literally, right? Someone said organs, skin, right? Right. Literally every cell in your body has DNA. Okay. So this is why lupus is actually called the great mimicker. The great mimicker. You know why? Because it is almost as if you're going whack-a-mole. You have symptoms everywhere. It can attack the skin. It can attack joints. You can have chronic fatigue, depression. It can affect the kidney. I mean, you name it. When I deal with people with lupus, no two lupus people are the same. And the reason is because we have DNA all over our bodies. And depending on which part of the DNA your particular immune system likes to attack, it's going to be different on Wanda than it is going to be on Jade. And it's going to be different on me, for example. So, but lupus is one of those that's going to be really important for you guys to understand. Autoimmunity is attacking a lot of things. It's not just about one target. And lupus is the case where the target is DNA, which is in everything. So doesn't it make sense then that doesn't it make sense then that we start looking at how do we calm the immune system? How do we deal with what's the root cause of this problem? What is fueling this immune system to misidentify and attack so many things? That is the core problem in MIST and the core problem with autoimmunity. And lupus is a really great example of that. And it's really not uncommon for me with lupus patients to also experience a lot of central nervous effects like vertigo, tinnitus being in the ears, Raynaud's syndrome, which is like it affects the blood vessels in the fingers, so it turns pale. And how many of you now are sitting here thinking like, oh yeah, and here's the problem. Do you know how many people have been told only one test is positive, but the other's not positive? You don't have lupus. So in the meantime, you're going to be on hold waiting. What are you waiting for? Your kidneys start to fail, right? Depression for 6 months, so you can't work. Some final tests turn positive that would never turn positive because you didn't fit that one type of lupus, right? That's a really diagnostic problem. And here's the thing. 90% of people with lupus are women. Women, right? So how big of a problem is this how big of a problem is autoimmunity for not just lupus, but anybody with any autoimmune disorder, with lupus showing you all the different places this can impact, right? Yeah.
Yeah. So a couple of things as far as that goes, like this really, what you were saying really shows the problem with our healthcare system, in the sense that there is always this idea of you're not quite sick enough. It's a wait and see. We're, we don't really have the test, so I can't give you, or the test came back negative, so I can't really give you anything for this, because my doctor training says if you're test negative for this, then this doesn't happen.
Yeah.
And it's like this checklist, right? And if you don't fall squarely into the checklist, then whatever's wrong with you is irrelevant. Well, it doesn't fit in nicely and neatly into a box.
Well, and I see Dina asking question after question about symptoms or Sjogren's. I see Elizabeth, who's in chat right now, saying hello. Thank you, Elizabeth, on YouTube. The vast majority of people that we see, that we deal with, have tons of different targets, symptoms, and they literally feel like they're a chicken with their head off. And they're advocating and driving their own healthcare through a myriad, a parade of specialists, charade of specialists who are just like, oh, you don't have MS because that workup is negative. Well, what about my joint pain? What about my, Raynaud's? What about my thyroid? That's not connected, but you don't have MS. Let's scoot you to the next specialist, the next specialist, the next specialist. We're taking autoimmune disease and we're saying, well, we're going to take that one target we could identify if you're one of those lucky individuals, and we'll send you to that specialist. What does a neurologist for MS, which is one of the most common autoimmune diagnoses, know about hormones, about joints, about digestion, about histamines, right? About POTS? Nothing, right? But yet those are the other targets and those are the other symptoms that are happening. So we're not really serving people with some of these really common diagnoses by sending them off to the rheumatologist. Crohn's, sending them to a gastroenterologist, and even MS, sending them to a neurologist. That doesn't really solve the problem because they don't have a big picture approach to this. Yeah. So let's go to psoriasis and psoriatic arthritis. I really like this one. Okay. Psoriasis and psoriatic arthritis. This is where I like it's a great example because psoriasis we think of as an autoimmune attack against the skin, which is a connective tissue, right? This is something I kind of want to talk about, is connective tissue. So connective tissue in our body is not bone, not muscle, but everything that connects bone and muscle. And also includes skin. So there's connective tissue on your skin. There is connective tissue in your intestinal walls. And so in psoriasis, think about this. People would just say, send you to a dermatologist because it's an autoimmune disease against the skin. And it actually involves some of the immune cells in the skin, right? Now, here's the interesting thing. Skin is made of connective tissue and you're being sent to the dermatologist. Well, why do they now have a diagnosis called psoriatic arthritis that affects the joint? Why? Because joints are also made with connective tissue, just like the skin. So this isn't a skin and dermatologist problem. This is actually impacting on the joints. And remember I said there's also connective tissue in the lining of your gut. This affects digestion. This affects how your gut moves, the bloating, the constipation or diarrhea. This affects your reactions to food. So we can't simply categorize, even though it's so common. 7.5 million Americans alone have psoriasis, and 1/3 of those people are later diagnosed with also psoriatic arthritis. diagnosed, meaning like some x-ray finding or some lab work, other things. So I'm just going to tell you is that, you know, it's not just about the skin. This is a perfect example. And I love saying how the outside skin is just a mirror of what's happening on the inside skin. Well, the outside connective tissue is just a mirror of what's happening in the inside connective tissue. And this is why people with psoriasis is skin, joints, gut, hormones, you name it, thyroid, it's a syndrome.
Mm-hmm.
And somebody mentioned how Dina, I think you had mentioned Sjogren's. Well, with Sjogren's, right, it can be against connective tissue. So there's a lot of joint associated with it. But in Sjogren's also, it likes to be against what are called lacrimal tissues. So tissue that actually secrete mucus. So it can affect the dryness in the eyes, the saliva gland. But where else could you have those glands? Vaginally, in your gut, back of the throat, ear, nose, throat, dental, like, right? So in Sjogren's, it's another example, not as common as these top 5 we're talking about, but it can involve multiple areas. And it isn't just a joint thing. It isn't just a dry eyes or dry mouth thing. We start to notice it's really about other areas of the body as well, because connective tissue is everywhere. And Sjogren's is one of those that involves connective tissue as well. Okay. Scleroderma falls in that category too. If you have questions about your diagnosis, go ahead and pop it in chat. I would love to like blow me up in chat. Any questions or feedback you have, any ahas you have around your diagnosis or lack of diagnosis, pop it in chat, right? Go ahead.
So what I find interesting is even last night we were working with someone, a young woman, we'll call her B, and she, you were asking her a bunch of questions. Because she had joined the program with her mom, and you were just asking her a bunch of questions. Yeah. And then it was like, oh, and I have this. Oh, and I was diagnosed with this. Oh yeah, and oh yeah, well I do have the no, I don't have Ehlers-Danlos, but I kind of do. And like the list,
her joint is like this.
Yeah, exactly. But the list went on and on and on and on. And this young woman, I think she's 19. Yeah. And I was like, this is very typical of the people that we work with on a daily basis. And this is where the MIST syndrome is fully applicable, because instead of looking at it as like all these individual pieces, we can see like how those autoimmune attacks are just everywhere in this young woman.
Well, in B, there's a pattern, and this is a pattern. If you guys start listening to this pattern and see if this describes you or your child, okay, which is like 19 years old, hypermobile joints, frequent injuries that really doesn't heal that well. And this, some borderline thyroid numbers, hair loss, hormones with acne, with irregular or heavy periods, right? And bouts of severe panic and anxiety, let's say, right? And also has some eczema and some really bad bloating with food, and notices recently that, you know, with certain foods, she's starting to not like be able to tolerate it. It seems like stuff she used to eat now is responding to more and more. And then all of a sudden now, while she's working out, she's starting to get dizzy. Mm-hmm. Mm-hmm. Does it sound like you? Mm-hmm. Right? Like this is a syndrome I'm seeing over and over and over again, and it's one syndrome. And so we've had a lot of people work with us recently, you know, in the last 2 years, because I love working with POTS through the lens that it's an autoimmune disorder. And I am able to solve it because POTS, postural orthostatic tachycardia syndrome, dysautonomia, long haul, it's the same problem. They have an immune system that is attacking various areas of their hormones, nervous system, gut, you name it. And it's causing them to actually have all these bouts of really fast heart rate, slow heart rate, blood pressure up and down. But it's part of MIST, multi-systemic immune symptom targeting, right? And it is a solvable problem. How many people have POTS out there? Because Pam just wrote vertigo, and how many of you have tinnitus, ringing in the ear, right? If you want to learn more about how I've been able to turn around POTS for right now, we're at, I think, 890 plus patients over just the past 2 years alone. Put POTS training in chat, because I went through in the training how big the problem is, how it's really missed the autoimmune link with it, and what needs to be done to address it. And so I have a POTS training. If you want to put that in chat, if you put that in chat, I'll get the training to you around POTS, right? There are so many, and someone wrote mast cell, MCAS. Sonia wrote mast cell activation syndrome, another immune system dysregulation here that's linked with all the autoimmune disorders. But wait, there's more. I'm going to ask you guys something. What do you guys think is one of the most common diagnoses we associate as autoimmune that's actually linked with gut? We haven't talked about the gut as much. Is celiac disease. Can we talk celiac here? I mean, how many people know they are celiac, think they're celiac, or doesn't even care what that diagnosis is, know that gluten triggers flares like crazy in you? Type it in chat, right? The interesting thing is, globally, I mean, only like 1 in 100 people are diagnosed with celiac. Okay. And that's wrong. I'm going to tell you that right now. And there's and celiac, just to define it for people, is for people who eat gluten. When they eat gluten in their bodies, it triggers this really irritating autoimmune attack in their gut that goes insane, right? And it can permanently destroy the lining in the gut. If there's gluten on it, your body's going to attack the hell out of it if you have celiac disease, to the point of destroying all the cells and all the lining in your gut. Now, here's the thing. Celiac disease, I mean, Kathy, this is interesting, was diagnosed initially by biopsy in the gut. And they said, oh, celiac disease is a disease of the gut. All of you with celiac out there, gluten problems out there, is it only a disease that involves your gut? Do you think the only target under attack is your gut when you eat gluten? Type in chat for you. When you eat gluten, what other targets are under attack, right?
Can I tell you a little story about this?
Yes.
So a good friend of mine was diagnosed with celiac as a small child. And then at some point, I don't know exactly what happened, but he was actually told he grew out of it. He grew out of his celiac disease, meaning basically he wasn't symptomatic, didn't have gut symptoms anymore.
Diarrhea. Blood.
He didn't have that anymore.
Okay.
But 20 years later, he's got thyroid autoimmunity, joint pain, and a whole bunch of other things going on.
Yeah.
And it's like, and eating gluten, had been eating gluten for decades.
Yeah.
And when he initially said, oh yeah, I was diagnosed with celiac when I was a kid, but I grew out of it, I was just like, what do you mean? What do you mean?
You never grow out of celiac. You can't grow out of celiac.
How do you grow out of celiac?
But that's the misunderstanding, that celiac is just a gut disease and that's the only target, right? So can I tell you guys something, that what I see really common in celiac is that always 100% of people with celiac, if celiac disease was diagnosed today, it would be considered a neurological illness, which means that there's tons of symptoms related to brain zaps, headaches, migraines, depression, ADD, autism spectrum, growth delay, neuropathy, nerve pain. Like in celiac, it isn't just the gut cell when exposed to gluten that it actually attacks. When you actually eat the gluten, it triggers the attack of every target that immune system wants to attack. And I promise you, all these nerves, brain, even brain hormones are under attack in celiac. So celiac is not a gut autoimmune disease, and it doesn't belong in a GI doctor's office. I hope, boom. Was that a boom? Give me a boom.
That was a boom. Yes. Right? You know what I also love, though, is I think it was Dr. Beatty, who also works with us. He's a Transform instructor, said that the only way, maybe it was you, Dr. Maggie, the only way to actually diagnose celiac is with this biopsy. And if the biopsy is positive, that means that you're at end stage. There's already enough damage in your intestinal tract that this biopsy is going to come back showing celiac disease.
Let me show you guys an example, okay? If someone says, I can only diagnose celiac disease when your biopsy comes back and shows this. So imagine this is a normal gut cell. There's the base of the cell of your intestine, and there's all these what we call villi sticking up, and there's millions of these cells lining your gut, right? If they biopsy it, when they see that there's nothing left, it's a Sahara desert in your gut, just lining, and none of these villi sticking out anymore. Oh, you have celiac disease. That's permanent destruction of all the villi there, then we're like, oh yeah, it's like saying like, I'm really not interested in cancer prevention, even though there are signs of this in this person for 20, 30 years before. And there's other ways to actually figure this out. But when you do get cancer, I'm really smart oncologist. I can diagnose you with cancer. That's what we have reduced like the diagnosis and treatment of celiac disease to. I have so many GI docs who tell my clients that you don't have a problem with gluten, your biopsy is negative, go back and eat it. And meanwhile, the person is sitting here with debilitating headaches, joint pain, and mental health and chronic fatigue and hormones that are kaput, right? My GI doctor says my gold standard of the biopsy is negative, so I don't have celiac. I can go back to eating gluten. And no, that's not true. And gluten-related illness isn't just celiac, okay? How many people don't have celiac, but know that when they eat gluten, their autoimmune disease symptoms get worse? How many people? If that's you, type it in chat, right? This is really important to share. I have Hashimoto's and I have mixed connective tissue, okay? Here's what happens to me when I eat gluten, okay? True story. So when I eat gluten, well, there's many things, but this is the most dramatic. If I accidentally eat gluten, my entire right leg, actually left leg, goes completely numb and my left leg goes weak. What does this tell you about what does my autoimmune, what does my immune system like to attack? Nerves.
Yeah.
Nerves. And guess how many years and decades I've been dealing with chronic pain, neuropathy, right? I have like this thing called fibromyalgia. I have TMJ. I had fibromyalgia, right? I had nerve pain up the wazoo for decades, right? But no one ever said, oh, you have an autoimmune issue that likes to attack nerves and it's eating gluten makes it worse, right? Because it's a super trigger of this autoimmune attack for you. No one's ever said that. And I had to figure that out the hard way. So this is why it's really, for me, really important that when we work with people, you know, with any sort of symptoms, and it can involve any part of the system, and it's a lot, which is why I'm going to say something here, okay? If you're asking me, like, what can you do for Sjogren's? What can you do for lupus? What can you do for my POTS or mast cell? Look, I can't help you by you watching this training, right? But what I can do to help you is I need to ask all these questions about all these systems. And I created a 360 health evaluation where when you go through it and you answer all these questions, it gives us a really good idea of what systems are under attack. Remember, MIS is multi-immune symptom targeting. So if nobody's really sitting here asking all these questions about these different symptoms and then generating a report and an evaluation and going it over with you, how the heck do you know it's connected when none of your doctors really understand that this is a syndrome? Right? So if you are interested in doing the 360 health assessment and going through the evaluation and having us review the results with you, we're going to put a link in chat for you to do that. We've really been starting to do those, and it's been, I would say, it's been the funnest work in the last year that we started. It's been so thrilling to have people not only have their symptoms being asked about, being listened to, but when your results are reviewed with you and they're put together into what actual systems or what's fueling this thing, it brings so much clarity. So that's the only way that I can really help is if I know and you share with me what's going on with your health and you allow us to ask those questions of you, right?
So here's what I love about the 360 assessment.
Yeah.
I'm so happy that you created this because what it does, and even the name, the 360 assessment, because what I see with our broken medical system is that we've talked about this many times. Somebody going to the psychologist, to the rheumatologist, to the endocrinologist, to the neurologist, to the proctologist, to whoever, right?
The apologist.
The apologist. and so they're getting taken out into all these different, it's like a little fan. Everybody ends up being spread out and nobody's talking to each other.
Yeah.
But what Dr. Maggie does with this 360 assessment is she has a bird's eye view.
Yeah.
She has the bird's eye view. So she's looking down and
Yeah.
she's able to see the psychology, the neurology, the
Yeah.
endocrinology, the whatever, right? And so this is why it's so important. And why I love this assessment is because it really does give us the bird's eye view of what's going on. Yep.
Oh, there's some questions. We're going to have some questions. I want to say questions, but I want to answer something though. I was talking to Julie today, who just did the 360 assessment. Julie, if you're watching, hi. What she shared with us was that she said, I really appreciate that you were a family medicine doctor first, got sick, and then became a functional medicine doctor. And the reason is I can talk to you about all my nervous system problems, all the autoimmune problems, hormone problems. I can talk to you about digestion and the food and all that. You know what I'm talking about. And I can even talk to you about my 14-year-old daughter, for example, because as a family practitioner, I was also trained in pediatrics and geriatrics. I can talk to you about my mom's dementia, which, by the way, all these are connected, right? So that was the piece you were talking about. Is like, I think the way that we've approached autoimmunity or any complex chronic disease by sending people off to specific specialists without that 30,000 square feet above bird's eye view, I think really does a disservice to these autoimmune issues that people are really dealing with.
Yeah.
Yeah.
Absolutely.
Ooh, I'm not even going to talk about the sleeper diagnosis because I want to answer some questions. Our team says that there's a ton of questions, and so I want to have Kathy and our team spotlight some questions for me. Let's do some questions popcorn style because I want to answer your biggest questions around autoimmunity. Let's do that.
All right. Let me go back here because
under the start.
Dina has a lot of questions. She has a lot of symptoms. Everything from her last comment that she said was when she eats bread, she has to peel it off because she doesn't even produce enough saliva. So I guess that's with the Sjogren's.
Right? With the dry mouth and the saliva thing, right? So when I eat bread, I have to peel off my lips since I don't produce enough saliva. Correct. Yeah. And so here's the thing. What I do is I look at this and I'm going to be asking like literally 90 questions around this, and Mike, it's going to be, well, what other targets are under attack? Is it really just Sjogren's, or is there a bigger picture going on? And how do we stop the attack? Not just against the dry, saliva making glands, but how do we stop the attack against the eye dryness glands, against the joints, or against, the fatigue, things that are causing fatigue, like the mitochondria or DNA in her body, right? So I like looking at big picture. So really importantly is first step in dealing with autoimmune disease is take the 360 assessment, so that we can actually map out exactly where the areas that are under attack is. And then the approach to any autoimmune disease is to stop the autoimmune attack. And you know what I'm going to do? I'm going to actually do a live training next week. You guys had talked about it last week, and I said there's over 100 of you that asked for it. I'm going to deliver. I'm going to invite you guys to join a live training, me, you in a room, not on social media, me, you in a room. So it gives you plenty of opportunity to ask questions. I'm going to go over what are actually the root causes of all autoimmune diseases and how I've helped over 10,000 people turn around their autoimmune disease already. Okay. And yes, every autoimmune diagnosis, no matter how hard, how rare of a zebra you think you are or no diagnosis, I have and I can help. And I want to show you how. So I'm going to put a link here. It's next Thursday. I'm going to do a training around how I have helped over 9,000 people with autoimmunity up to at this point, 9,000 plus, 10,000 plus right there. And you have to register. You'll get reminded to join. It's free, and I will see you there. I'm going to go into what causes. What are the most common things that are really underlying kerosene under fire that cause any autoimmune disease and how to fix it. All right, let's go to questions.
So Kay says she's had thyroid cancer, myasthenia gravis, some sort of arthritis, many benign tumors, hypermobility, and POTS.
Yeah. So there's a syndrome right there. And, what was the first thing you said?
Thyroid cancer and then myasthenia gravis.
Yeah, if you can put the words in there, that's really helpful. So I'm going to say something here, right? Thyroid cancer, it's not thyroid cancer. Thyroid cancer is the result of decades of autoimmune attack against the thyroid cells, turning them into cancer cells. It's an autoimmune disease, and it's an endpoint for someone with autoimmune attack. And most of thyroid cancer don't ever even know that it's an autoimmune disease and the result of endless autoimmune attack against your thyroid. And then myasthenia gravis, another autoimmune disease. And then now she has POTS, another autoimmune thing. So instead of going to 20 specialists to deal with this, you need a 360 bird's eye view of the above to be like, how are these connected? What's really what are the things that are fueling this for you? And then how do we fix it? So I love like the patterns that I'm starting to show you. So you're not a super special rare zebra. In fact, you're my bread and butter.
Mm-hmm.
Okay.
Could we get Catherine's comment highlighted? My daughter has POTS, possible celiac, Ehlers-Danlos, and pernicious anemia.
Ehlers-Danlos, POTS, and pernicious anemia.
Celiac. Yep.
That's a syndrome right there.
Mm-hmm.
Okay. That would be easy. Catherine, celiac, we just talked about. Ehlers-Danlos, autoimmune against joints. Pernicious anemia, autoimmune attack against digestion and absorption of certain vitamins. One syndrome. Okay. So anybody connected all three of those for you before, Catherine? I'm right here. Okay. I'm right here. Let me have at you. Let me have at her. Right. So really importantly, I think doing a 360 assessment with us so we can really take a look and give you the 360 view above, I think would be really helpful. Absolutely common syndrome. Okay. There's also a study. Did you guys know there's a study that came out last year that actually said, medical fact, and I've been saying this for a long time, but there's actually a medical study that actually shows now that POTS, mast cell activation syndrome, and Ehlers-Danlos are actually one syndrome. Okay. Meaning one grouping of MIST that they've identified. There you go. All right. Next, popcorn.
So the next one is Lori Underwood. Lori Underwood. So she has ulcerative colitis, depression, anxiety, GERD, and no DM. I don't know if that's no DM, but I don't physically heal well. So ulcerative colitis, depression, anxiety, GERD.
There we go. So, Lori, these are all linked, right? Ulcerative colitis is autoimmune attack against the connective tissue in the large intestine, causing bloody diarrhea, right? Pain. Frequently also with joint pain. Just so you guys know, any sort of these Crohn's, ulcerative colitis, any sort of these gut colitis, connective tissue. So then the attack is connective tissue. So then people tend to have a lot of joint problems as well. Now think about that. GERD, heartburn. How often do you guys think heartburn is associated with people with autoimmune disease? What if there were the cells that make stomach acid are under attack? So they don't have enough digestion. They have poor digestion, right? And then think about this, the mental health, the depression, anxiety. How frequently do you think the nerves that make the brain hormones in the brain are under attack, causing brain hormones to be low, right? And she doesn't physically heal well because her connective tissue is what's needed to heal. So this is one beautifully wrapped with a bow syndrome that is a solvable problem. Okay, I love this, right? Next popcorn question.
So the next one's from Mita, and they have their gallbladder removed. Do I need to take any precautions or any medications for digestion?
I actually did a training, and if someone's interested in the training, I did a live training where I talked about why is our solutions to many of these medical issues is a surgical solution. So people who've had hysterectomies, people who've had gallbladders removed, people who've had part of the thyroid removed, their whole thyroid removed, people who've had part of the uterus removed, fibrorectomy. I did Beyond the Scalpel, which was a live workshop that I did going over exactly why surgical solutions to not dealing with the real problem is a serious problem. If you're interested in that training, that workshop I did, it's called Beyond the Scalpel, and whoever wants to see that training called Beyond the Scalpel. People get their gallbladders removed because the underlying problem with fat digestion was never identified or treated by their physician because there is no training for digestion. And it is a big issue fueling autoimmune disease, right? So really importantly is a big part of our food mapping program, for example, is mastering what digestion problem you have and how to fix it, and also identifying the food allergies. So one of the journeys working with us is to fix this digestion problem that has never been fixed for you, Mita. And then they took the organ that's actually was needed to actually address that problem. And now you're left with, what the hell do I do? right? So really importantly, food mapping as a program or as a part of one of our journeys is really helpful in identifying fixing digestive issues, and on the other side, identifying the worsening food allergies and food reactions that she has. So do I need to take any precaution, the medications for digestion? Hell yes. Digested is really great. There, just wanted you guys to know that in the store is a bundle called the Daily Reset Bundle. They are 3 of the must supplements for anybody with autoimmunity. 3 must. And I can absolutely do another live, which I will around it. But if you have autoimmunity and the first question you have is, what are the 3 must supplements I must take, is in the Daily Reset Bundle. And I'm going to put the link in here. In that bundle, I'm going to tell you is Digested, #1 selling supplement in our store, because I developed it for people with autoimmune issues, who has a lot of gut reactions and who have a lot of allergy issues. So Digested is in there. And Mita, get the Daily Reset Bundle. Start the Digested, 1 with small meals, 2 with big meals, and just thank me later, Mita, right? And then the other 2 supplements in there, one is a B complex called Boost Me. That's like insanely helpful for mitochondria and energy. 2 of those in the morning. And then at night is Restore Me, which is a magnesium blend that's designed to actually help all the enzymes that help your body detox, make hormones, sleep, relax. So it's called the Daily Reset Bundle, and it is in the store. I'll put a link in the chat. And it's the 3 musts for anybody with autoimmunity. And it addresses some of these issues like the gallbladder issue or the low stomach acid issues that Carrie was talking about, along with the energy and the sleep issues.
All right. Next we have G. Brewer. Any comments on COVID and IgA deficiency?
Yeah, it's linked. So what we're finding is the big C, COVID, is that it is a super trigger of the irritant of the immune system. Certain types of infections are super irritants of the immune system. Lyme can do that. COVID can do that, right? And Epstein-Barr. And when you get infected with it, certain individuals that are more susceptible to it will develop long haul. They can develop POTS. They can develop dysautonomia, or they can just get a new diagnosis of an autoimmune disease. And already this person, G, says also linked as IgA deficiency, which means that a certain part of an immune system that's there to fight germs is low. So it doesn't make sense if it's irritating the immune system to attack your own body. Then the antibodies, the armies that are there to fight germs are low. Doesn't it make sense? You can't just be high everything or normal everything. If something is really overactive, you're going to have other parts of your system that's really underactive. So this is part of the same syndrome. This is why 20% of the people we work with have long haul and the immune system sequelae that's triggered as a result of it that are all connected. And I haven't even talked about hormones, but hormones is a huge trigger of autoimmune attack. COVID literally will also attack the cells that make hormone and shut down hormone production for months or years. And that's part of the problem as well. So I have done a lot of trainings around long haul. If you're interested, put long haul and tell me in chat a little more about what's happened for you with, with the COVID or long haul. Type it in chat. Give me some information around that. Or you know what? Take the 360 assessment. And so we can ask you all the questions about all your symptoms and then go over your report and your results with you. Yes, I can help your daughter if she lives in Australia. We work globally around the world. You're not limited geographically at all. I love the fact that we are educating you from anywhere around the world that you're watching me. We can reach you. We can work with you. And this is the wonderful part of what it is that we do and why I bother being on social media on a regular weekly basis. We can work with people around the world.
All right. Let me just see. So Sandeepa is just asking, do you know how to cure autoimmune and Hashimoto's?
Yes, answered. Next.
Let's see here. Hi, Doc. Okay, this is from Bibi. Watching from upstate New York, I'm interested to know more about PMR and MGUS. Been battling inflammatory arthritis for 5 years now, and lately been diagnosed with PMR.
Yeah, and Bibi, what you're going to find is you're going to be getting more and more of these labels and more of these acronyms, right? And just even looking at PMR, polymyalgia rheumatica, right? People don't have any idea what, doctors have really no clue about PMR, to be honest. What it's saying is polymyalgia rheumatica is really describing the symptom. polymyalgia means multiple muscles. Rheumatic meaning they know it's autoimmune related. So, it is, and it's a lot of people never even get diagnosed with PMR. They might be told they have fibromyalgia. They might be told that they have neuropathy and all that. So when you're looking at this, it's no wonder too, she has, muscle polymyalgia is muscle related. But around muscles are what? Ligaments, tendons, and joints. And no wonder she is also having inflammatory arthritis for 5 years now. They're linked, right? And MGUS, all of these are linked. And, so it's just one syndrome. And yet, are we going to be a sitting duck to wait for more and more diagnosis here? Or are we going to figure out what's feeding it to stop the attack? This is where medications aren't really working for autoimmune disease, because you go to one doc for the one symptom for MS who doesn't know anything about your hormones or your joint pain or your digestion. And they're just the one drug to shut off a certain part of the immune system. And meanwhile, all the other parts of the attack is still going crazy and there's nothing to be done. And these drugs stop working or can have really horrific side effects when you just shut off a big part of your immune system. This is where higher risk of cancer comes about, because the immune system is there to also fight cancer cells. So we need our immune system to work for us. So I love the fact that I'm able to work with people's immune system, look at what's feeding the problem, and really lowering that attack, no matter what the diagnosis is.
And I think this would be a good one to just end on, Dr. Maggie, because Mary is talking about all kinds of digestive issues, which we haven't really touched on a whole lot. And all so bloating, swelling in the stomach, malrotation of small intestines, constipation, pain throughout the body, and then all of the testing that is being done for the digestive issues, which is, we always talk about the huge connection between digestion and everything else.
I probably have at this point 50 videos around digestion linked with every disorder known to man. Okay. And this is a big problem, is that I would say 50%, those of you watching out there, this is not hyperbole. 50% of your symptoms is because your digestion is broken. Okay. And so really, to learn more, you can go to my YouTube channel, just search my name, Maggie UMD digestion. And you're going to see so many videos that are going to come up related to every single disorder you can imagine. And this is the hallmark of any autoimmune diseases. Did you know, I'm just going to tell you this, there's a study that tested one step in digestion, which is low stomach acid. And they checked like hundreds of people with rheumatoid arthritis. And they found how many percentage of people with rheumatoid arthritis had low stomach acid. Do you guys know what that study showed? 90%. Okay. So what is the pattern that I know in any autoimmune disease is 100% of people with any autoimmune disease or suspected autoimmune disease have one or multiple steps in their digestion is broken. And the testing that we have for digestion sucks. You will never end up with a diagnosis that is going to treat and end this problem, because doctors aren't equipped to diagnose this properly and they don't know how to treat it. And the answer isn't a prescription drug. So then no pharmaceutical company is going to want to do research in this, is to really learn more about digestion and know how to actually support which step in digestion, but also identify what food allergies are causing and mixing in with this problem. So food mapping is a system I created to actually tease this completely apart using your data. So I love being able to offer that for people. And that's really a big thing. And, you're going to go through that $1 million workup. And when you come up with nothing, and maybe before you go through the $1 million workup and come up with nothing and no help, you should book go do the 360 assessment, and then book your call with our team after that to go over the results and go over like what is a sane, actually effective way to address digestive disorders, period. Yeah.
Yep.
Christy mentioned something really quickly. Okay, so here's the thing. We're going to wrap this up, everybody. But Christy said, and this is a really common question, and I want to actually end with a bang with this one. Is dermatomyositis really rare and one of the worst autoimmune diseases? I get this question on every autoimmune diagnosis known to man. 100 times a day. Is XYZ really rare? Is scleroderma 3.4? Is this really rare? Is this one of the worst? Can you not treat it? This is so rare. Dermatomyositis is not actually as rare as you think. Scleroderma isn't as rare as you think at all. None of these autoimmune diseases are actually rare. The reason they're rare is because the ability to diagnose them suck. Physicians don't recognize it. And when they don't recognize it, diagnosis sucks. The delay in actually people recognizing they have an autoimmune disorder goes overwhelmingly long. And then we get a lot of end stage results, making it harder to treat. So if you're on that diagnostic merry-go-round, no matter what diagnosis you're seeking or whatever, yes, do it, right? But at the same time, if you really want to know what's causing it and how to end it, honestly, do the 360 assessment and have a review and a call with our team. It's not that rare, and it's not the worst by any means, Christy, and we deal with it all the time. There you go. Okay, everybody, let's take a look. I think that is a wrap. We have a lot of questions. So a couple of things importantly, okay, everybody who's still here with me, sign up to join me on the live training on next Thursday. I'm going to go over exactly what's fueling autoimmunity and how I helped around about 10,000 people turn around the autoimmunity. Yes, I've been at this a long time, 27-year career, everybody. Mm-hmm. And then click the link, register to, and I would love to see you guys, because that's why next Thursday I won't be live, because I'm going to be live in a room with you on a live training that I'm going to be doing. So click the link and register to do that. And then if for any of you that are thinking, can you help me? Can I get a report and a result review on a 360 look at my health? There's a link in chat for you to do that. And I'm happy to be able to do that. So that's a wrap, everybody. Kathy, anything for the audience?
I loved Amy's last comment there. Bam. Like, just that's it. There's nothing else to say. Bam.
All right. Bam, everybody. Have a wonderful night.